Welcome back to our channel, where your well-being is our utmost priority. We are living in an era where medications play a crucial role in our health. They can offer some benefits, but they also pose silent threats. As we age, our kidneys may not function as efficiently, making it crucial to minimize their exposure to excessive chemicals and medications. However, this becomes challenging as aging often brings numerous health problems, necessitating more medications. Certain drugs are nephrotoxic, meaning they can directly or indirectly harm the kidneys. This can lead to a reduced ability of the kidneys to filter blood, causing harmful waste to accumulate and potentially leading to serious health issues. The severity of kidney damage is measured in stages from mild dysfunction to complete failure. The risk of kidney damage from medications or drug-induced nephrotoxicity increases with age and pre-existing kidney conditions. There are two main types of kidney damage caused by medications: dose-dependent toxicity and idiosyncratic toxicity. Dose-dependent toxicity means that damage escalates with higher doses. In contrast, idiosyncratic toxicity is unpredictable and varies significantly between individuals. Sometimes, avoiding these drugs altogether is the best option. Drug-induced nephrotoxicity can result from muscle tissue breakdown, rhabdomyolysis, kidney tissue death, renal infarction, and acid buildup, renal tubular acidosis. This can lead to decreased kidney function and other conditions like nephrotic syndrome or electrolyte imbalances. In this video, we'll delve into how common medications affect kidney health and offer practical tips for managing these drugs safely. Understanding the risks associated with these medications can empower you to make informed decisions about your healthcare. Let's embark on this journey together to achieve better kidney health and overall well-being. 1. ACE inhibitors, angiotensin-converting enzyme, ACE. Inhibitors are prescription medicines widely prescribed to lower blood pressure and manage conditions affecting the heart, blood vessels, and kidneys. Common ACE inhibitors include lisinopril, Zestril, Prinivil, Ramipril, Altus, enalapril, Vasotec, and benazepril, Lotensin. These drugs work by blocking an enzyme that produces angiotensin II, which narrows blood vessels and increases blood pressure. By stopping this enzyme, ACE inhibitors help relax blood vessels, thereby lowering blood pressure and reducing stress on the heart. ACE inhibitors also improve blood flow to the kidneys, easing the workload on these vital organs. This enhanced blood flow can protect the kidneys, especially over the long term. Moreover, ACE inhibitors may help reduce the presence of protein in the urine, a common problem in chronic kidney conditions. ACE inhibitors are commonly recommended for people with kidney disease. While these medications have protective benefits, they're not without risks. When combined with NSAIDs and diuretics, the risk of acute kidney injury, AKI, can increase. Additionally, insufficient hydration while taking ACE inhibitors can increase the risk of AKI. If concerned about the risk of AKI, it's best to talk to your doctor about ways to lower it. 2. Diuretics. Diuretics help with conditions like fluid retention or swelling, often seen in heart and kidney failure and liver cirrhosis. Some diuretics are available over the counter, but prescription diuretics are typically stronger. Common diuretics include hydrochlorothiazide, HCTZ, bumetanide, Bumex, furosemide, Lasix, spironolactone, or aldactone, and acetazolamide, or Diamox. They work by increasing urine output. They're also effective in expelling excess salt and water through urine, which can help with hypertension or high blood pressure, a leading risk factor for kidney disease. While diuretics are generally beneficial, they don't come without risks, especially concerning kidney health. They don't directly damage the kidneys or affect their filtering function like NSAIDs. Instead, they act further down the kidney's process, altering the urine's concentration and composition. Excessive use or high doses of diuretics can lead to dehydration, a risk factor for kidney damage. A study examining 131 patients using diuretics found that those who used these drugs had higher rates of kidney disease and its risk factors like hypertension and diabetes. The higher the dose, the greater the risk of acute kidney injury caused by diuretics alone or in combination with other drugs. 3. Lithium. Lithium is a prescription medication used for mood stabilization and treating certain mental illnesses, including mania and bipolar disorder. Brand names of lithium include Priadil, Camcolit, Lisconum, and Lie Liquid. For over 60 years, lithium has significantly improved the lives of many individuals suffering from bipolar disorder. While lithium can be a lifeline for calming mood, its impact on the kidneys cannot be ignored. Long-term use of lithium can lead to serious kidney issues, including both acute and chronic kidney disease, as well as kidney cysts. Early on, kidney damage from lithium might be reversible, but it could become permanent with time. The main issue with lithium use is nephrogenic diabetes insipidus, a type of diabetes linked to kidney damage. This condition is caused by the kidney's inability to respond properly to the antidiuretic hormone, ADH, which controls fluid balance. As a result, one may experience excessive thirst and frequent urination. In rare cases, long-term use of lithium can even lead to end-stage renal disease, ESRD. Moreover, lithium can make the kidneys excrete too much sodium, a condition known as hyponatremia. Sudden hyponatremia, where sodium levels drop quickly, can cause serious problems if not treated, including muscle breakdown, severe confusion, seizures, coma, and even death. 4. Non-steroidal anti-inflammatory drugs, NSAIDs. NSAIDs such as ibuprofen, aspirin, Motrin, ketorolac, celecoxib, and naproxen are widely used, and some are available over the counter. Over 30 million people take NSAIDs daily. They are commonly used to alleviate headaches, sprains, strains, colds, flu, and arthritis pain. NSAIDs work by inhibiting an enzyme called cyclooxygenase, COX. This enzyme is crucial for producing substances that cause pain and inflammation. However, COX also plays a role in protecting the kidneys during times of stress and in regulating sodium and water excretion. When NSAIDs block COX, they can interfere with these protective functions, leading to potential kidney damage. All NSAIDs have the potential to cause acute kidney injury, AKI, particularly in older adults and when taken in high doses or over extended periods. This injury can occur due to changes in blood flow and inflammation resulting from COX inhibition. If left unchecked, this can escalate to more severe conditions such as acute tubular necrosis and acute kidney failure. A 2006 study published in the Journal of the American Society of Nephrology analyzed data from over 10,184 individuals prescribed NSAIDs. The study revealed that NSAID use increased the risk of acute kidney injury by 26%, especially within the first 30 days of use. Another study examined patients with chronic musculoskeletal pain who took NSAIDs for 12 months and found that most experienced a decline in kidney function, which normalized after switching to an alternative pain reliever. 5. Antiviral drugs. Most viruses clear up without antiviral drugs, but doctors prescribe them for serious or long-lasting infectious diseases like COVID-19, Ebola, flu, genital herpes, hepatitis B and C, and HIV. These drugs can clear the flu and combat other viruses from your body. For the flu, two common antiviral drugs are oseltamivir, Tamiflu, and zanamivir, Relenza. For chronic infections like HIV, hepatitis, and herpes, antivirals can't cure them completely, but they can ease symptoms and reduce their severity. Antiviral drugs offer many benefits in treating viral infections, yet their potential to harm the kidneys cannot be overlooked. This risk, whether from direct toxicity or crystal buildup that can cause kidney stones, is a serious concern. Careful management and customized treatments are necessary, especially for people with existing kidney problems. Remdesivir, a drug for emergency use in COVID-19 cases, contains a substance called SBECD, which is mainly removed from the body by the kidneys. In people with kidney issues, SBECD might build up and cause kidney toxicity. Some clinical trials have inconsistently reported a decrease in kidney function with remdesivir. Data from global databases showed a significant increase in cases of acute kidney failure associated with remdesivir compared to other COVID-19 drugs. However, there hasn't been enough large-scale clinical data to confirm whether remdesivir is safe or harmful for people with kidney issues, so further studies are necessary to provide clarity. The use of other effective antiviral drugs often leads to drug-induced acute kidney injury. Some antiviral drugs like cidofovir, adefovir, foscarnet, acyclovir, interferon and tenofovir can directly cause cell death in kidney tubules by reducing blood flow or increasing toxins. This condition is called acute tubular necrosis. Additionally, the antiviral drug atazanavir can cause inflammation in the interstitial tissue of the kidneys, impairing kidney function. Also, acyclovir, indinavir, and foscarnet can cause crystals build up in the kidneys, blocking the kidney tubules. In contrast, some antiviral drugs like Viriad and foscarnet can help manage kidney damage, but they also pose a notable risk of kidney failure. Therefore, taking these drugs under close medical supervision is crucial to safeguard the kidneys. Additionally, to safely use antiviral drugs, never skip doses or inconsistently take them. This practice can lead to virus adaptation, making the antiviral less effective. This is called antiviral resistance. 6. Antibiotics. Antibiotics are prescribed often, but they are not without risk. Antibiotics, also known as antibacterials or antimicrobials, are a group of medications designed to combat bacterial infections. They work either by killing bacteria or preventing them from reproducing. Common antibiotics include Cipro, Augmentin, Flagyl, Bactrim, and amoxicillin. These drugs could be prescribed to treat strep throat, pneumonia, urinary tract infections, UTIs, or skin infections. Antibiotics can treat bacterial infections, but they can't treat viral infections such as colds, flu, bronchitis, most coughs, and most sore throats. Misuse of antibiotics can lead to serious side effects, including damage to the kidneys. So, you should be extra cautious when your doctor prescribes antibiotics. If prescribed improperly, you might experience side effects such as diarrhea and liver and kidney problems. Even when properly used, some antibiotics such as polymyxins, aminoglycosides, and vancomycin can harm your kidneys. Your kidneys play a crucial role in removing antibiotics and other drugs from your body. Antibiotics like polymyxins may damage kidney cell membranes, possibly causing kidney injury. Similarly, aminoglycosides can accumulate in kidney cells, causing cell death and harming kidney tubules. For antibiotics to be effective and safe for kidney health, it's important to use them correctly. Nearly 1/3 of antibiotics prescribed in the United States aren't even appropriate for the conditions being treated, according to a report from the Centers for Disease Control and Prevention, CDC, and a study published in the Journal of the American Medical Association. 7. Proton pump inhibitors, PPIs. Proton pump inhibitors, PPIs, are widely used medications available over the counter. These drugs effectively treat conditions like gastroesophageal reflux disease, GERD, or acid reflux by reducing stomach acid production. This is because PPIs target an enzyme in the stomach called H+/K+ ATPase, or proton pump, which is crucial for acid secretion. Although PPIs are generally safe and great at soothing acid-related discomfort such as heartburn, they still carry risks, particularly for kidney health. For example, PPIs have been linked with acute interstitial nephritis, AIN, a kidney disorder characterized by inflammation in the spaces between the kidney tubules. Even though only a tiny number of PPI users develop AIN, this drug has become a common cause of drug-induced AIN in developed countries. More concerning, AIN caused by PPIs often shows no apparent signs and often goes unnoticed. So, long-term PPI use may lead to lower kidney function and acute sudden kidney injury. Over time, this can even progress to chronic kidney disease, CKD. An often overlooked side effect of long-term PPI use is low magnesium levels in the blood, or hypermagnesemia, which is linked to CKD. Hypermagnesemia can disrupt your electrolyte balance and cause inflammation, triggering kidney disease. Low magnesium can also lead to other serious health problems, including muscle spasms, seizures, and irregular heartbeats. A 2019 cohort study in the Journal of Pharmacotherapy investigated the effects of PPIs on kidney function. This study checked how PPI use relates to new cases of acute kidney injury, AKI, and chronic kidney disease, CKD, in a large group of people. When they examined a group of 93,335 people, they found that those taking PPIs had a 4.35 times higher risk of AKI compared to those who didn't. Similarly, taking PPIs was linked to a higher risk of CKD. When researchers examined a group of 84,600 people, PPI users had a 1.2 times higher risk of CKD compared to non-users. So, people taking PPIs should have regular checkups to monitor their kidney function and magnesium levels. Regular monitoring can help catch potential issues early before they progress to more serious conditions. While PPIs can provide significant relief from acid-related issues, long-term use of them can harm your kidneys and cause other problems such as infections, fractures, or nutritional deficiencies. It's crucial to use PPIs for the shortest duration necessary and to explore other treatment options when appropriate. Extra tips for safe medication. Use. Do you think your medication might be impacting your kidney health? It's crucial to seek medical advice immediately. Kidney failure symptoms might not be obvious at first, but as the condition progresses, signs like reduced urine output, leg swelling, shortness of breath, and extreme fatigue become more noticeable. If left untreated, the consequences can be severe. Make sure you recognize these symptoms so you know when to take action. If you're on any of the medications discussed in this video, regularly monitor your kidney function with tests that check blood creatinine levels, glomerular filtration rate, GFR, and urine protein levels. Staying well hydrated helps your kidneys flush out sodium, urea, and toxins, reducing the impact of nephrotoxic drugs. Be mindful of potential drug interactions that could affect your kidney health. Always inform your healthcare provider about all the medications you're taking when you receive a new prescription. Medications are vital for managing various health conditions, but some drugs can significantly harm kidney health and should be used with caution, especially in people with existing kidney disease or those at risk of developing kidney issues. Antibiotics, NSAIDs, diuretics, proton pump inhibitors, ACE inhibitors, antiviral drugs, and lithium all have the potential to damage kidney function through mechanisms like direct toxicity, altered renal blood flow, and electrolyte imbalances. For those with kidney disease, it is essential to avoid or carefully manage the use of these medications. Collaborate with healthcare providers to choose treatments that minimize risk to the kidneys, adjust dosages appropriately, and regularly monitor kidney function. Maintaining a healthy lifestyle can help reduce the need for medications. Aim for a balanced diet with lean protein, fruits, and vegetables, and engage in regular exercise to protect your kidneys from damage. If you found this information helpful, please give this video a thumbs up and share it with your friends and family. Don't forget to subscribe to our channel for more health tips and wellness advice. Thank you for watching. See you soon in our next video. Goodbye.